Welcome to Sex Care is Self-Care, a conversation on women's sexual health, brought to you by the She Plus Foundation. I'm your host, Patty Brisben. I'm coming to you with two really very special guests, Yevanit and Victoria from Free the Pill. All right, Yevanit, can we start with you? What do you do on a daily basis? There's a lot of listeners out there that want to know a little bit more about what do you do for Free the Pill. And
Of course. Thank you, Patty. It's so nice to meet you, and thank you so much for having us. My name is Yevanit Reschechtko, and I'm the Senior Associate Communications Director at Ibis Reproductive Health, which manages the Free the Pill Coalition. Free the Pill team, I oversee communications to help make sure that people know what Free the Pill does, that people know about Opill, the first ever over-the-counter birth control pill in the United States, and that people can hear about the history of our movement and all the work that we've done to get to this moment. So thank you so much for having me.
thank you. Victoria?
Hi, Patty. Thanks so much for having Yevanit and I. I'm Victoria Nichols. I'm the Senior Project Director for Free the Pill, and I oversee our 250 plus member coalition, our policy and advocacy work, and our partnerships. We work with lots of collaborators, including all the members of our coalition, as well as pharmaceutical companies interested in bringing birth control pills over the counter, and many others who are really dedicated to this issue. And so I'm really excited to talk with you today.
I'm so excited to have this conversation. So thank you both for joining. And I think it's always good to stay a student and learn more about what's going on out there. So what is Free the Pill, and how were you inspired to do this?
And I'm happy to start with that question. It's a great question. We have a really rich history that is always a pleasure to talk about. So Free the Pill is a project of Ibis Reproductive Health. It involves a coalition and a campaign, and it's really a movement to bring birth control pills over the counter in the United States, ensure that they're equitably accessible, they're priced affordably, fully covered by insurance, and accessible to people of all ages. The Free the Pill Coalition work actually started at something called the Oral Contraceptives Over the Counter Working Group, and it started back in 2004. And it was really inspired by a group of researchers, providers, and reproductive justice partners who wanted to know if a birth control pill could be brought over the counter in the US. Over 100 countries around the world had over the counter birth control pills. Excuse me. And so they wanted to know, is it safe? Is it effective? Is it appropriate for over the counter use? And so that group grew into the Free the Pill Coalition over time, and really started by building the evidence and support around over the counter birth control pills. Did really important research in the early days to understand whether this was something that could happen in the US, and had a long-term vision for this work. So really proud to work with many of those partners still to this day, and to have grown the coalition over the past 2 decades to this moment.
Awesome. Yevanit?
Sure, I can just share a little more about kind of our public-facing campaign, which is something that I work on. We have our coalition members who do a lot of this strategic work, and then we also have a public-facing campaign because we want to make sure that people know about what we're doing, that people understand that birth control pills are safe and effective and appropriate to be available over the counter. And now that we have a birth control pill that's available over the counter, we've been really focused on making sure that people know about it and that people have all the information they need to make a decision about whether they might want to use it. Yeah, it's been exciting to see our coalition and our campaign evolve over the years.
That's awesome. Can you walk us through the current landscape for contraceptive access in the United States, and what did this kind of look like before 2025? You said, has it been available since 2020 or 2004? The birth control, this you can purchase?
No, so this is new. And yeah, it's very exciting that we have now today Opill, which is a progestin-only daily birth control pill that people can walk right into a pharmacy or a retailer or even online and buy it without a prescription or an ID requirement. But this was not the case before March of 2024, so last year is when Opill first came onto the market. It was approved by the FDA for people of all ages in July of 2023, and then took a little bit, to get onto the market for folks. But before that time, people in the US who wanted to use birth control pills had to get a prescription from a provider. And that can be really challenging for people, especially folks who may be uninsured, for young people, for people living in rural areas, because, having to make an appointment with a provider, get to that appointment, and pay for that appointment can be a really big barrier. And we know that it's not like medically necessary to do that in order to safely use birth control pills. So, it's really exciting that we have this like new way of accessing contraception in the United States. This is just one type of birth control pill. And so, while this is a really big win for contraceptive access, we know there's still a lot more work to do, both to make Opill more accessible. We know that, cost can still be a barrier for folks, and a lot of people still don't know about Opill. And then, also thinking about all the other contraceptive options out there. Opill might not be the best for everyone. And so there are still barriers to access other types of contraception.
Okay,
And I'll just
go ahead.
I was just going to add on to what Yevanit said really well, is that Opill is, the first birth control pill to move over the counter. This is like a groundbreaking change in reproductive health care. And that being said, it's one product. And so we want to make sure that other birth control pills move over the counter, both generic versions of progestin-only pills, which is the type of birth control pill that Opill is, as well as other types of birth control pills like combined oral contraceptives. And so it's going to take more time for the FDA to approve more birth control pills to move over the counter. Eventually, we want to see, many other products over the counter for people to access without a prescription.
So, I have a quick question on this. So, I'm living in a rural area and there's really no doctor around, and I'm going to go somewhere. I'm going to order it online or whatever, however I'm going to get this. Is this going to have information on how to take this in the pamphlet itself, and if it's safe for me, and am I going to be able to know this?
Sure, yeah. That's a great question and a really important one. And yes, absolutely. Opill has a pamphlet inside the packaging that has all of the information that people need in order to understand whether the pill is right for them, and also to know how to take it and make sure that they're taking it in a way that it will be effective. And we actually, part of the FDA process is about whether that packaging and that label is easy for people to read and understand. And so there were studies that were done on this packaging that found that people of all ages were able to read and understand the package and decide for themselves whether that this was the right medication for them, and also understand how they should take it safely and effectively.
Awesome. Um, what are some of the biggest barriers that people face trying to trying to get birth control pills? And we talked about rural areas. What are some of the other barriers?
So, even though we have an over-the-counter birth control pill, I think cost is still a really big barrier that
Yeah.
people face. Opill has a suggested retail price of $20 for a monthly pack. And for a lot of people, that just might not fit into
Yeah.
their budget. And so we've been working to address this in a few ways. we're trying to make sure people know that there are some ways that they can get low or no cost Opill, such as through Opill's bulk distribution program, which allows nonprofit organizations, Title X clinics, and 340B clinics to distribute Opill free of cost in their communities. We also know, again, that a lot of people don't know about Opill, and that is a barrier because it's new. People haven't heard about it, and they're not going to be able to use it if they don't know that it exists. And then, kind of tying into, your previous question, we know that people may not know a lot about birth control generally. And so there's a lot of misinformation or confusion, especially in the media and social media landscape right now about birth control, which is a barrier. So we know people may be confused about the different types of medications that are used for reproductive health and making sure people understand that Opill is a birth control pill that needs to be taken daily. It's not emergency contraception. It's not an abortion pill. And then also just concerns around the safety of hormonal birth control, and making sure people have, evidence-based information about how safe Opill and other birth control pills are.
Right.
And you have a plus one to everything Yevanit said. Unfortunately, I can just add to the list of barriers that exist right now. But one of the other things is around OTC insurance coverage. And so under the Affordable Care Act, birth control pills are supposed to be required to be covered by insurance. However, companies can and often do require a prescription for coverage. And so if you think about the over-the-counter, birth control landscape, to go to a pharmacy or a retail store or purchase something online and want to get it covered by insurance, but then to have to get a prescription for that coverage is a huge barrier to get coverage for birth control, over-the-counter birth control. And so we're actively working with partners to try to remove that barrier because it really doesn't make sense for something that's over the counter. And there are states that are implementing policies. There are 10 states with laws on the books that require coverage for over the counter birth control without a prescription. And so there are ways that states can go beyond that. Beyond insurance coverage, there's also things like different programs that provide health care to different communities. For example, Indian Health Service serves Native communities, and there are barriers to accessing over-the-counter medications in a lot of those clinics. And so there's a lot of work to do to ensure that people can access over-the-counter birth control without any logistical barriers at an affordable price or even for free if they need it.
Awesome. Well, I hear that congratulations is in order. On May 9th, there was a big celebration it was Free the Pill Day. What does this signify?
Yeah, thank you for highlighting that. Free the Pill Day is a day that we've been celebrating every May 9th for the last 7 years, to commemorate the date in 1960 that the first birth control pill was approved by the FDA. So as you can see, it's been a long time that we've had birth control pills available in the US, even though it's only recently that they've been available without a prescription. And actually, coincidentally, in 2023, the FDA's advisory committee meeting to review the application for Opill happened to also be on Free the Pill Day. So there's a lot to celebrate. And now that, we have a birth control pill available over the counter, we like to use Free the Pill Day as a moment to celebrate our movement and the 20 years of history and work that went into getting here. But also to, advocate for equitable access to make sure that people know about Opill, and really have the information that they need. So this year we implemented kind of a fun Tell 5 Friends challenge to really emphasize the importance of grassroots information sharing, and encouraging people to let their friends know that Opill is available over the counter, and spread the word by word of mouth because we want to make sure that people are aware of this new option.
It's awesome.
And Free the Pill Day is one of my favorite days of the year. All of our coalition partners are really engaged and get loud on social media. And we also have our general campaign supporters that get engaged as well. It's a great opportunity to spread the word about over-the-counter birth control.
Awesome. Well, I thought it was a great day to celebrate. And I had no idea that the first pill was launched on May 9th. So thank you for that information. I'm sure that you have an answer to this. What are the biggest misconceptions about over the counter birth control that you guys hear? What are some of those?
Yeah, this is a great question. Unfortunately, there are a lot of misconceptions, not just about over-the-counter birth control, but also about birth control
Mm-hmm.
generally. I think one of the biggest confusions that we run into is people just, seeing there are so many different types of medications and pills that are used in reproductive health and not being sure, what the different pills are for or what they do. And we actually, last year, to address this, worked with our coalition partners at Reproductive Health Access Project to create a fact sheet that really outlined the differences between daily birth control pills like Opill, emergency contraceptive pills like Plan B, and abortion pills, and making it clear, that these are all different medications. They're all very important to making sure people can be safe and have healthy reproductive lives. But they're different. They serve different purposes, and they are used in different ways. So that's been a really important piece of information to share, especially as we're sharing information about Opill to make sure people understand that it's a daily birth control pill. It prevents pregnancy. And then, there's a lot of misinformation generally about hormonal birth control methods, or the idea that hormones are bad or dangerous. People have concerns that birth control pills might affect their future fertility, which is not true. And so, the truth is, birth control pills are some of the safest medications on the market. They've been studied extensively for a really long time. And so, it's just important to make sure people have that information and are comfortable with understanding what Opill is and that it's very safe.
A couple of other misconceptions that come up for us often is I think even within birth control pills, there's different types. So there's different formulations. I talked about this a little bit earlier. There's progestin only pills, and then there are combined oral contraceptives. And as the name suggests, progestin only pills only contain one type of hormone called progestin, whereas combined oral contraceptives contain estrogen and progestin. And there's a lot of similarities between these different types of birth control pills, but there are also important differences that people should know about. And I think people often get the different types of pills mixed up. I think that's understandable that people get them mixed up. But with Opill being over the counter, I think it's important to know that Opill is a progestin only pill, and there's certain you know factors that come into play with progestin-only pills when it comes to Opill that aren't really a factor for combined oral contraceptives and vice versa. So part of this education, especially we have an opportunity with Opill on the counter to educate people about what progestin-only pills are, how they can benefit people, what people should be, what people should know about before they take them, and that label within the box of Opill is really important for people to read and understand. And of course, the FDA did a lot of research around people understanding that label. So a lot of this is about getting the information out there, making sure people know about it, and spreading awareness, which is really important for our work.
There you go. So let me ask you, if there's a listener out there right now that says, "Oh, I think this is for me," and they want to go because they're concerned with safety, is there a place that they can go view this information right now online?
Yes, there are lots of resources. We have resources on the Free the Pill website, so freethepill.org. We have FAQs that describe what Opill is. And then there's also the manufacturer, Perrigo, has a website, opill.com. And then there's also opillcap.com if you want to learn about cost assistance opportunities. But those websites have lots of information on what Opill is, if you want to learn about it before you see it in the store.
There you go. Um, so what's next? What changes still need to be made to make birth control a little bit more accessible? And how possibly down the road can somebody who is really on a very fixed income get it for free?
That's a really good question, and one that we think about a lot at Free the Pill. As you said, taking the prescription barrier away was a big win, but cost is really a significant barrier for folks still. And so there are a few options that we're working on. One is the cost assistance program that Victoria just mentioned, which Perrigo has instituted, as well as a bulk distribution program. And so we've been working with our coalition members to figure out how to make sure these programs are accessible, especially to the communities that we know could benefit most from access and that often face the highest barriers to healthcare and birth control access. And so, we're working with our partners to make sure that they can distribute Opill at no cost in their communities, to think about what information they might need to do that, and answer those questions that you mentioned that people might have if they are receiving Opill for free from an organization. And then, we also know that this method may not work for everyone, which is why, as Victoria mentioned before, we're also continuing our work to bring other types of birth control pills over the counter, and hopefully also at an affordable price.
There you go. Good.
And just adding on to Yevanit's points, another thing that we need to continue working on, of course, is expanding insurance coverage options. Insurance is really important for people, especially around over-the-counter access. It ensures equitable access and provides affordable options for people. There are 10 states, fortunately, that have gone beyond the ACA in California, Colorado, Delaware, Illinois, Maryland, New Jersey, New Mexico, New York, and Washington state. There are laws on the books that require OTC coverage. But we know from policy work that just because there's a law implemented doesn't mean that it's operationalized in the state. And so there's still work to do with state advocates to ensure that those laws are being implemented properly, ensure that pharmacists know in those states that how to process a claim in the pharmacy, and to really support access that way. Beyond insurance coverage, there's things like HSA and FSA cards that allow people to cover many products, including over-the-counter birth control pills that people can use. But we also need other insurance plans, large employers, PBMs to step up to really make sure that this is fully covered by insurance so people can access it in their communities without obstacles.
There you go. Where do you see this movement going and growing in the next 5 years?
I'm happy to start with that one. So we mentioned before that Opill is exciting. It's the first pill that went over the counter in the U.S., but we certainly don't want it to be the last. There's other birth control pills that can move over the counter, including generics, including other progestin-only pills, and also combined oral contraceptives. We know that there are going to be more challenges that come up, especially in this political climate, but we know that there's really important work to be doing to lay the groundwork for other over-the-counter switches. And we hope to work with different pharmaceutical companies, work with partners in our coalition, work with young people who have been such strong advocates in our in our movement to bring more pills over the counter. So that's what our vision is for the future of this work, and we're really committed to making that happen.
Yeah, and I'll just add, I think I keep on saying this, but it's so important that we keep on expanding awareness of Opill and over-the-counter contraceptives. Right now it's still a novelty, it's still new to people, to know that birth control pills are available without a prescription, and people may be a bit wary because it's not familiar. And so we really want to get to a point where people, this is normalized. People are thinking, oh, it's just like condoms to go out and buy, birth
Yeah.
control pills over the counter. And hand in hand with that is really, that work that we keep talking about around combating misinformation and just making sure that people understand the safety of this product and really understand the importance of birth control and that it is safe. In this political climate, I think that information is also so important and such a big piece of the work that we want to do to ensure access to folks.
So let me ask you, have you heard stories from people out there that been advocates for the pill or are pill users themselves that have stuck with you that you can share with the audience?
I'm happy to start. So I didn't mention this before, but we, as part of the Free the Pill Coalition, have a formal youth adult partnership model, and that means that we center young people as leaders in our coalition, and they serve on our steering committee that guides our coalition and makes decisions on behalf of the larger group. And we also have a partnership with Advocates for Youth, which is a an organization that is right there alongside me, advocating for their reproductive health needs. So Advocates for Youth did a survey a couple of years ago before Opill was approved, and they called it the Behind the Counter survey, where they asked young people, what are the biggest barriers that you face when trying to access contraception through this prescription model? And we heard lots of really compelling stories from young people through that survey about the challenges that they had around transportation, around stigma that they faced when trying to take care of the reproductive health care, around cost barriers, around just general obstacles that they face, and how much an over-the-counter birth control pill could really make a difference in their lives. And it's so wonderful to look back on that report now to know that this research that Advocates for Youth did, our coalition work in partnership with young people, all kind of culminated to this FDA approval win that we got in 2023. And now there's a birth control pill on shelves nationwide. So all of the young people who reported in that survey that they were having challenges with everything from stigma to cost barriers, now have a solution, a potential solution for them to access in their communities without having to jump through all the hoops that existed for them before Opill was on the shelf. So it's really great to also look back on some of those stories and know that we have a product now that can meet some of those needs that were raised.
It's awesome. Yevanit, do you have anything to add?
Yeah, thank you. I'll just add, I think one of the most powerful moments where a lot of those stories were shared and made a really big impact was actually during the FDA process. There was an advisory committee meeting where expert advisors who were reviewing the application had a chance to hear directly from the public through a public testimony period. And we had over 30 of our coalition members testify, including 5 of the young people on our youth council. And those stories were so powerful. The young people really shared their personal experiences that they had had, supporting their friends on college campuses, driving them to doctor's appointments, having to figure out how to pay for a doctor's appointment or birth control if they didn't feel comfortable, involving their parents in that. and also facing a lot of stigma and judgment from providers when they were interested in starting to use birth control. And it was really powerful, for us hearing all of that testimony from our coalition members. And it was also powerful for the advisory committee. They actually, a number of the advisors, when they were sharing their votes to recommend Opill to be approved for over-the-counter use, actually explicitly referenced the testimony from young people and said, that it really showed the urgency of this need and the importance of expanding access in this way. And ultimately, that advisory committee voted unanimously to recommend that Opill be approved for over-the-counter use for people of all ages, which was a really huge win, and I think really shows how important that those stories from those young people were and what a big impact they made.
So I think what you're doing is great. And let me tell you why. Because I have two granddaughters, both just have graduated college. And, every time I entered one of their campuses, I was always had 25,000 questions, especially when it had anything to do with sexual health. And it's like they go from home, graduating high school, onto college. They're leaving a pediatrician, and there's been nobody educating them or helping them. And once they hit college, it's out of our hands, right? And so I'm happy to know that, and you should really be big on most college campuses, and the information should be out there because you are needed, and especially education, because none of these kids are getting any type of education when it comes to sexual health, and that just infuriates me. But thank you for the job that you do, and thank you for what you do for women. It's amazing. How can we and our listeners support Free the Pill? How can we do that?
Yeah, thanks for asking. And I just want to re-up again our partners at Advocates for Youth who do so much work on college campuses to make sure that young people are getting that education and that they know about Opill. But one really important way that people can help is just by helping us spread the word that Opill exists. It's something that, everybody needs to hear. A lot of people still don't know about it. And so sharing evidence-based information, you can go to our website at freethepill.org. We have a lot of resources about Opill, about birth control pills that Victoria and I have referenced already. People can also join our campaign list if they want to get involved in our digital days of action. We mentioned Free the Pill Day earlier. We also always share other big moments like the anniversary of Opill's FDA approval, which is coming up in July, World Contraception Day in September. So those are really important ways to kind of get involved and help us spread the word. And Victoria, I'll let you jump in as well.
Thanks, Yevanit. Yeah, there's lots of opportunities to get engaged. Another way to engage is to just follow us on social media. We're very active on Instagram, Facebook, X, Twitter. We're on Blue Sky now. Several of our partners are also on TikTok, which is great. And then you can always donate to support our work. We want to keep this work going. This work takes a lot of work from our team, from our coalition, from our partners. And in order to spread information, we do need, support from folks as well. And so you can go to our website to support us and get engaged. And we, of course, invite folks to do both.
Perfect. Well, we'll make sure that we get those dates up on our site as well. So make sure Bree gets those and we'll put them up. I always ask, anytime I do interviews, did I miss something? Is there something that you would love to talk about or add to before we end this conversation?
I think one thing that we often get asked is, wow, like 2004, like this took a long time.
Yes.
Why did this take so long? And I always, respond that, you know, policy change takes time.
Yeah.
This was a movement-driven win that was done intentionally in partnership with young people, in partnership with reproductive justice leaders, and it took time to not only build the evidence and answer really important questions that our reproductive justice partners were raising around, "Is this safe for our community members?" And building evidence for ensuring that this was gonna be accessible to people of all ages. That took a long time. Finding the right pharmaceutical partner that would commit to our values and move this forward in a way that was gonna expand access to the most people, and then advocating to get this over the counter. Policy change takes time,
Mhm.
so having the long-term vision for work is really important, and not giving up when you hit roadblocks, and working in partnership with a broad coalition has been really critical for us to be successful. I think if you're doing this work alone or in silos, and you're not doing it in partnership with really core partners, it's harder to get through the long stretch that it takes to get policy change implemented. So I think that's one really important takeaway if you're, trying to make a policy change, to stick it out and do it in partnership with organizations that are really committed to these issues.
Go.
Yeah, I mean, Victoria, really, I think that's one of the most important takeaways and something that, is really important to remind people about our coalition. This doesn't happen overnight. It takes a lot of work and a lot of collaboration. And so it's been so wonderful to get to see the fruits of this labor. But I think as we keep on working in a challenging environment, it's just so important to remember that, things take time and partnership and hopefully this win can be a little bit of a beacon of hope when things feel frustrating. I know for our team, we really like to remember, we achieved something even though we know there's still a lot of work to do. We have really great partners to do it with.
There you go. I know it takes time. We work in the research field, and it takes time. It's not like McDonald's. You don't drive through and put your order in, and thank God that doesn't happen, because when you put this information out, you want people to know you've done the legwork and that it's safe. So I just want to say thank you, thank you, thank you so much for giving this information out to all the listeners here today, and staying strong and using your voices and your power to help women. So thank you for everything that you do. If you like what you heard, please rate and subscribe to our podcast. For more information on the She Plus Foundation, go to www.sheplusfoundation.com. And remember, sex care is self-care, and sexual health matters.